So during all of these negotiations, Republicans have accused Democrats of pushing for taxpayer-funded health care for undocumented immigrants. The Democrats have called that a lie. Our Danny Spiewak is looking closer at this particular claim, joins us now, and you're sorting everything out for us, Danny.
Yeah, Jennifer, under federal law, undocumented immigrants are already ineligible for programs like Medicaid. That is not changing, but the Democratic proposal to fund the government does seek to repeal provisions of the One Big Beautiful Bill Act passed earlier this summer that restricted health care for lawful immigrant groups. During the shutdown, top Republican leaders such as House Speaker Mike Johnson,
illegal aliens would be paid for,
and Vice President J.D. Vance have claimed that Democrats won't vote to open the government unless they secure health care benefits for people here illegally.
They gave us legislative text that would have undone us cutting off health care benefits for illegal aliens.
Based on a 1996 federal law, though, unauthorized immigrants are already ineligible for federal health care programs like Medicaid.
And not a single Democrat has raised the issue of trying to reverse that federal law.
Instead, the Democratic counterproposal to fund the government seeks to reverse parts of the One Big Beautiful Bill Act that limited certain lawful immigrants from enrolling in programs like Medicaid.
That includes many people who are here as part of a humanitarian program like refugees and asylees, people who are paroled in the U.S. who are survivors of domestic violence.
Matthew Lopez with the National Immigration Law Center notes that these groups are not considered undocumented.
What Congress did this last summer did not affect the eligibility of undocumented immigrants at all.
There is a separate provision in the law that reduces federal reimbursements related to emergency care for undocumented immigrants. But even if Democrats successfully repealed that, hospitals would still be obligated to provide this care under federal law. The requirement for hospitals to provide emergency care to everyone, regardless of immigration status, has been around for several decades. It was signed into law under President Ronald Reagan in 1986. Jennifer.
So let's just be clear here, Dan. Both sides obviously using different tactics. Republicans, though, essentially control Congress, right? So why are they unable to pass a bill?
So the reason is because in the U.S. Senate, there's something known as the filibuster, a procedural rule that basically protects the minority party. You need 60 votes in the U.S. Senate to pass a bill to get past the filibuster for certain legislation such as this. Democrats have enough members that are able to stop that. The Republicans don't have a big enough majority, basically, to get it through the Senate without bipartisan support.
Right. Good clarification, which is why they need so many of those Democratic votes to move forward here.
Yep, exactly.
Thanks, Danny. Thank you.